Masks are now required inside all of Boston's public spaces to prevent the spread of COVID-19. Here to answer your questions is Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester, joining us. Thank you so much for being with us today.
Great to see you, Dr. Finberg, as always. The new mandate took effect at 8 o'clock this morning. So bottom line here, do you think it will have a significant impact on the city's case numbers?
Yes, masks work to prevent spread. The new mandate will decrease spread.
Okay, do you think, we know the mandate does not apply to private homes and workspaces, but, what do you think about that? Isn't that where the risk of infection is higher?
No, household spread is not a given. Many families actually have one member who gets COVID, and if they're careful and they wear masks and distance, the others won't get infected. It depends who is in those spaces and how they behave. If everyone in your workplace is vaccinated and they all wear masks and distance, the chances are very, very low of spread.
So let's talk about vaccines. As you know, the White House has proposed offering booster shots to people 8 months after they receive their second dose of either the Pfizer or the Moderna. But today, President Biden said health officials may want to distribute the shots even earlier, possibly at 5 months. What do you think they should do?
I think they need to look at all the data. I know that Pfizer and Moderna and J&J have submitted data to the FDA. And I think it's a complex issue. And I think what we need to do is to let the Advisory Committee on Immunization Practices and the FDA look at it and then decide.
I think a lot of people have a question about the wait, because if the data already shows that the booster shots offer more protection, why can't we just get them right now?
Because we don't really know when the best time to give the booster shots is. It could be that waiting longer gives you longer lasting immunity and fewer side effects. We don't even know for certain if this is the right vaccine to give. Those are the issues that people have to wrestle with, and I think we need the experts to think about it for a little while.
Doesn't that almost kind of rotates back to the original problem, Dr. Finberg? The unknowns create all the, well, I'm not going to get vaccinated because there are still too many unknowns.
Well, that's why I think, again, we need to look at all the data. I think we take all those things into consideration. I think we made the right decision last time, and we'll make the right decision in the near future.
Dr. Finberg, it's always great to see you. Thank you. Have a great weekend.
Thank you.